So what will happen if the patient is injecting insulin into the muscle? We all know that insulin injection meant for subcutaneous. Injecting into the muscle is a mistake. So what will happen? Injecting insulin in the subcutaneous fat, stable, consistent absorption and predictable results. So it should be given in the subcutaneous. By mistake, injection is given into the as an intramuscular, accelerated absorption, risk of hypoglycemia. So we should avoid. So thin persons, low BMI, using the long needles, all they develop the risk of intramuscular injection. So we need to use 4 mm needle for the pen devices, 6 mm needle for the syringes. If you use right insulin injection technique, by using these 4 mm, 6 mm needles, we can deliver the insulin in the subcutaneous fat, no risk of hypoglycemia. Balaji? Yes.
So, while we give the injection, sir will explain why to lift the skin for the injection and how to release the skin fold while the needle is inside the skin. So, ideally, we use the thumb and the index finger to use the skin fold. So, if we are not using it appropriately, the needle will not go particularly into the subcutaneous tissue. So for example, in those days we have been using the 6 mm and 8 mm needle were there. So if the skin fold is not approximately pinched, there is a risk of injecting the insulin into the deeper muscle, and the injection will be easily dissociated into the blood circulation, and the risk of hypoglycemia is very more. So that's why ideally the thumb and index finger should be used to lift the fold, and it can be possibly with the addition of the middle finger, and use of the whole hand as always the risk of injecting into the muscle. So that's the recommendation is with the things. So next thing is why to clean and not injecting into the cleaner sites.
Yeah, simple thing. Injection should be given into the clean sites using the clean hands. Many of the nursing homes, clinics, GH, private clinics, our staff members, they do not clean the injection site. It is, we have to accept it. So injection should be given into the clean site using the clean hands, for which we have to use an alcohol swab. If it is not available, cotton ball dipped into the water. These soap-based detergents should not be used. Cetrimide should not be used. Balaji, next.
So for the insulin pen injections, releasing the thumb button while the needle is inside the skin. So we use, nowadays patients use the pen injections. The use of vial has been gone. So once the thumb button is pushed into the skin, we have to, the patient should keep the pressure until the entire injection is being given and the injection is being released, the needle is being released from the skin. Then only they have to stop the button of the pen. So if the button is released while the skin is inside the skin, the body fluid and the cells may be aspirated into the cartridge, and it can cause contamination and cause more infection to the things.
Yeah,
So
well done, Balaji. Next one, Balaji has very clearly told, when you use the pen devices, inserting the needle, we have to keep the thumb button pushed in. The thumb button is pushed in. Ask the patient to keep pressure on the thumb button for 10 seconds. Why 10 seconds? Because to prevent the medication leakage after removing the needle, one. Number two, this gives you sufficient time for the injected insulin to spread out through the tissue planes and cause the tissue to expand and stretch. So we need to use, when we advise the patient initiate with the pen devices, we have to sit with the patient and educate all these things, then only you can get the optimized insulin therapy. Yes, Balaji.
So next is the reuse of needle. So we come across this type of thing in our common practice. So just see how the new needle, the tip of the new needle, how it is, once, after using once, and after using twice, and after using 6 times. So patients often use the reuse needles in the syringes and pen. What happens is they use it for the convenience aspect. But if they use the needle for this thing, the cause of pain, bleeding, lipohypertrophy, sterility, and infection is very high. The thing is, the damage to the reused needles is also high as they go deep into the rubber. For example, if they use the syringe needle repeatedly, they just inject into the rubber and take it. So the tip of the needle is becoming blunt more and more thing. The last thing is, if the needle is left in between the injections, the air can enter into the reservoir, into the pen, and affect the accuracy of the next dose of the things. So the entire multiple times if they use, the chances of the accuracy is less, and the cause of other infections and other thing is very, very high. So these are the various adverse effects if they use the needles repeatedly: pain, bleeding, contamination, and dosage inaccuracy, breaking off, and lipohypertrophy. The same thing.
Yeah. Well done, Balaji. Needles, before 10 years, before the introduction of fitter guidelines, what is our practice is, many of you will accept, we used to tell the patient that use the needle until you get the pain. This was a practice in most of the cities. But using reuse of needles, lot of these issues, we have to tell the patient, according to the recommendation, single use. But in India, pen needle is around 18 to 19 rupees. Our patients are not affordable. For all practical purposes, we use the needle 2 to 3 times, then we change it. This is not scientific message, but practical purpose we are using this. Yeah, this one, mixing the cloudy insulins, pre-mixed insulin, NPH insulin, we have to mix it, or resuspension should be done, but we are not doing it. Many of the places we are not doing it. What will happen? Inadequate resuspension can lead to varying concentrations of insulin, by which unpredictable results will come. So we have to resuspend, mix it. For which some patients, what they do is, they shake the vials vigorously. Vigorous shaking should not be done. Once we vigorously shake it, what will happen? Air bubbles will come, which will prevent the flow of the insulin. Adequacy, that is accuracy of the dose, will be lost. So resuspension, how will you ensure it? You roll it between the 2 palms or tip it for 10 times. The insulin crystals will get dissolved and mixed uniformly. Once a solution becomes milky white, you can ensure that it is properly mixed.
So next thing is injecting into the same site once again. So site rotation has to be taught to each and every patient. Most important thing is, so we know what are the regions of injecting into the thing: the thighs, the forearm, and the abdomen. So repeated injection into the same site always have the risk of infection. So one thing is, advise the patient to rotate the sites once in a week. So ask the patient to particularly focus on one quadrant in a single week, then in a clockwise direction, and then go to the next quadrant, and after a week likewise they have to rotate. So this diagram clearly depicts how to rotate the sites. For example, if you just take about the abdomen, so start from the left side of the abdomen, so and go in a clockwise direction in a single quadrant. So this diagram rotating within the same site. For example, if they just focus upon the upper lateral quadrant or upper left quadrant, the site should be rotated each and every time. So this is the way how to rotate the site rotation. So this thing is will avoid the risk of carrying lipoatrophy and other type of adverse effects.
Well done, Balaji. We have to tell our patients, ask the patient, first you ask your staff members to inspect the site, injection site. Every visit, we don't find time. We tell our dietitian, educator, check the site, then only it is good. And also educate the patient for self-inspection for any abrasion or wound or lipohypertrophy, all those things. Yeah, injecting into the LH site, it is wrong. We have to inject into the healthy site. So people, you are using insulin for long duration, not rotating the injection site, reuse of needles, the problem of developing LH, lipohypertrophy. What is the problem if you inject into the LH site? If you inject into the LH area, patient will use to develop unexplained hypoglycemia 1, glycemic variability 2, sometimes hyperglycemia. Why patient they tend to give the injection into the LH site? Because it is painless. So patient tend to use the same site again and again. We have to avoid. Then tell the patient switch over to normal site. when you switch over to normal side, from LH side, there is a possibility of developing hypoglycemia. So tell the patient